One of the things I enjoy the most about plastic surgery is the complex and creative thinking process that goes in to fixing a lot of the different types of holes that we see on people's bodies and faces. And there's a lot of different things we can do. For example, on the nose, there's probably 100 different ways we could fix a spot on the nose. Basically, kind of go through an algorithm, some people call it the reconstructive ladder, where we basically start with kind of the basic procedure first. What's the simplest thing we can do to fix this hole? And if that gives us a great result, then that's what we're going to go with. But sometimes we have to go further up the ladder. Sometimes we have to go to a more complex procedure. But ultimately, we're trying to find the simplest procedure that gives the best result. There's a number of factors that go into creating the best scar possible. First of all is selection of the appropriate technique to use. Secondly is the way you actually handle the skin when you're closing it. Trying to be non-traumatic and trying to gently pull the skin together. Some factors are out of our control. For example, the location of the scar. For example, scars over the joints, like the knee or the shoulder, or scars in the center of the chest often will tend to heal more thick than other locations. I'm going to show you a demo to kind of illustrate how this works. You'll see here a circle that I've cut out. As I try to put stitches in to close this circle, you can see that the ends are starting to pucker and bulge. This is an unfortunate result that will typically not go away. These dog ears, as we call them, will often persist for years and years and years, and often require surgical revision to reduce them. Now I'm going to show you what we typically do for a standard hole closure. Typically, we take that hole, we remove triangles, what we call Burroughs triangles on both sides of the hole, and pull the hole together. This creates more of a football-shaped hole so that when we close it, the ends do not pucker. The shorter the Burroughs triangles, the likely you might have some persistent bulging. The longer the Burroughs triangle, the longer the scar, but the less likely you'll have bulging.